I am an administrative assistant at the clinic. I've worked here for 15 years and know most of the patients, especially the ones who have been coming here for as long as I have. I answer the phone, make patient appointments, and get in touch with patients and give them their appointment information. Since our clinic has no specialists, all referral appointments need to be made by phone. Since we do not have an integrated electronic record system, a lot of communication and documentation is done by hand, which means that I need to make calls from referral slips that the doctors bring over to me. Our scheduling office is a little desk on the fifth floor of our clinic. Doctors have to come up to the office and drop off their referral slips. From this office, I make calls to different specialists to schedule appointments. Not all the specialists accept our patients, but I do have a list that I can work from. I prioritize urgent referral requests and try to make these appointments first, and then I get to the ones that are not urgent. Once I have made an appointment for a patient, I enter the date and time of the appointment in an internal database that I developed a few years ago. I also call the patient and let them know that the appointment has been made. I have no way of knowing whether the patients keep their appointments or not. Sometimes I hear that specialists complain about no-shows, but I don't know if this is a real problem or whether they're just complaining because our patients contribute less to their revenue. I do know that we do not schedule appointments as quickly as we should. The doctors are supposed to drop off their referral slips every day, but many of them drop them off every other day. I don't know if there are specific doctors who contribute more to these delays than others. I don't often see the doctors because they come up after I'm already gone and slip the envelope with the referral slips under my door. I don't know how many referral slips I get every day. I've never counted, but I do know that on most days I have more slips than I can get through, and therefore I feel like I always have a backlog. At the specialist offices, they are able to add temporary staff to manage schedules if they're overloaded. But, of course, we don't have the resources for additional staff here, so if we get behind, it just delays the patients. In general, at this point, we have enough specialists for most disciplines that we're able to get appointments for all of our patients that need referrals. Sometimes I may just need to call multiple specialists before I can find one in a reasonable time frame. We have no set requirements for how quickly we need to find referrals. The doctors just say, do this ASAP, especially the urgent ones, but I don't think that anyone is measuring how long the referrals take to schedule from our end and how many weeks out the referrals are scheduled for. I think it probably takes a couple of weeks for us to schedule a specialist appointment for 3 to 4 weeks in the future. I often hear patients complaining about how long it takes to get a referral, but they also complain about a lot of other things, such as the amount of time they have to wait for a doctor, their paperwork, their co-pays, their bills, even the waiting room furniture, and a whole lot else. But I do think that if there is a way to shorten the time it takes for us to schedule referrals, especially from our side, we should certainly take a look at it. After all, the patients who need referrals are also the ones who are the most sick, and it would be good to make sure that they get care as soon as possible. We definitely don't want a liability suit on our hands. God knows we have enough problems around here already.